recent publication in Fertility Sterility published in April 2022. This is on ovarian activation, or to be precise, mechanical ovarian activation. We have heard about ovarian activation done with PRPs, autologous stem cells, and various processes. But this is a mechanical ovarian activation, and this study has been published by IVI-RMA from the Palencia group, and it's a very interesting methodology which they have followed. This is about disruption of Hippo signaling. What is Hippo signaling? Hippo signaling is the mechanism, cellular mechanism, exists in all organs of the body. It basically limits the size and the function of the organ. Otherwise, imagine the cellular proliferation can just go on and organs will be of massive sizes. And this Hippo signaling, if you disrupt, then there will be increased cell proliferation, and in turn we can do betterment, especially in the ovarian tissue at the senescence when the ovarian cells or the number of follicles have come down. Can we activate the follicles by disrupting the Hippo signaling? The Hippo signaling disruption is commonly occurs when we do laparoscopic ovarian drilling at polycystic ovary cases. Because of the mechanical and electrical trauma to the ovary, the Hippo signaling gets disrupted. There is more proliferation and more follicles will become beyond 6 millimeter, and their favorability to grow will be there. That is the philosophy behind this. So this is methodology when it applied to women with low ovarian reserve. It is called ovarian fragmentation for follicular activation, or OFFA. The initial study on this was published in 2013 by Kawamura, and probably for last 7 to 8 years nobody worked on these things further. But this is a very interesting study observation which is done by this group. And they chose all the women who were satisfying the Bologna criteria, and endometriosis patients or patients who have undergone previous ovarian surgeries were excluded. They also excluded women more than 39 years of age. So this is very important. So we should not attempt this kind of a procedure for somebody who was beyond 40 and has such a low ovarian reserve that traumatizing the ovary, we really don't know whether it will be of any use, because the materials and methods, they clearly say they have excluded women beyond 39 years. In this procedure was done laparoscopically with the lab kept on standby. So they entered with laparoscope, and on the posterior surface of the ovarian tissue, they did a cold scissor cut, and they took out about 1 centimeter of the ovarian cortical tissue. It was taken to the lab besides it. The medulla part of it was removed, and all these procedures in the lab was done at 4 degrees centigrade. The medulla was removed, and there were 30 to 100 pieces of this cortex was done mechanically using scalpel or maybe needle. Then all those fragments with the culture media was aspirated into a gynetics probe catheter, and that catheter was again taken laparoscopically inside, wherein on the anterior surface of the same ovary a subcortical pouch was created, and this gynetics catheter was emptied there or pushed. All the fragments of the ovarian cortex just done were pushed there. Obviously, a small stitch was taken on the posterior anterior aspect if needed, so as to maintain the ovarian tissue and not expose it to any adhesions. After this procedure, obviously nothing was done on the other ovary, and after this procedure, the serial estradiol, AMH and FSH measurements were done every 2 weeks, and they had obviously a control group. So there were two controls. One was the internal control, was the other ovary which was not mechanically traumatized, and other patients of Bologna criteria satisfying the same criteria but not undergoing this ovarian activation. And of the observation, what they found was they detected an increased antral follicle count in the surgical group compared to the non-surgical group. And even in the surgical group, on the traumatized ovary, the AFC was more commonly seen. When these patients were subsequently taken for IVF, the women who were of the surgical group, they could be taken early because early expression of antral follicle count was seen, and they went for an IVF procedure much early. Later on, for the IVF stimulation, they used about 300 IU of gonadotrophins for all the patients. But When they analyzed the data about the oocyte number and the metaphase to oocyte, the pregnancy rate, no statistically significant differences were noticed in the ovarian activation group and the control group. So, this gives us an opportunity to look into a different method of ovarian activation, which is mechanical, done laparoscopically, and probably something very simple for all of us to practice. But obviously, we need a wider study, many more studies, and we need to put it to ethical committees, and our ethical committees have to sanction all these studies and go through a wider study to know whether it can have any more implications. Well, thank you so much. If you have any queries, do write back to us.